If you frequently wake up at 2 a.m., 3 a.m., this video is for you. I will tell you the most common reason why this is happening and what to do about it. This video applies to patients with Parkinson's disease and also without Parkinson's disease. However, there are some difference in people with Parkinson's disease, and I will tell you three of them, the most important one. Number one, sometimes people with Parkinson's disease wake up in the middle of the night or usually at 3 a.m., 4 a.m. because they are wearing off. What does that mean? That means that the medication, that usually is the levodopa, is out of your system, is out of your brain. So the brain will find a way to tell you, give me my levodopa. And the brain will wake you up. And sometimes wake you up because you feel very anxious. You cannot go back to sleep. Also, sometimes it might cause a painful contraction of one leg. We call that off dystonia, and usually is the bad side. Also, it might cause decreased mobility. And normally, people, when they are sleeping, they move and you don't wake up. But people with Parkinson, because mobility is affected when they are off, then they wake up. That's another reason. So what do you do with those patients? So you need to manipulate the way that you take your medications, the levodopa. Sometimes people require a long-acting formulation, a real long-acting formulation just before bedtime. And sometimes, if you are one of those that you have to go to the bathroom at 1 a.m., that's the time to take an extra tablet. That might help you to sleep as well. If you think that this is a off phenomenon. Sometimes it's very hard to tell, but this is a trial and error. Okay. Sometimes people get benefit with medication that work faster. So inhale levodopa work pretty fast, actually in 10, 15 minutes. Yeah, if you take a pill, the regular levodopa, it might take 30 minutes. It might take 40 minutes, depends. Every patient is different. But the Inbriha, which is the inhale levodopa, it might take 10 to 15 minutes to work, and that might help you. Other patients find that if they prepare actually homemade liquid levodopa, it's cheap because you can make that at home. That might help you. And it's just I have a video teaching you how to prepare the homemade levodopa. The description of the video will be the link of this video will be in the description of this video. Reason number two why patients with Parkinson's disease wake up in the middle of the night is because they are having vivid dreams. Very vivid dreams and usually unpleasant dreams. And they are acting out during sleep. When you are sleeping and you are on this stage of sleep, what we call REM, REM, rapid eye movements, you are supposed to be paralyzed. All your muscles should be paralyzed, not moving, except the diaphragm, the muscle of the breathing. In people with Parkinson, this is not working well. So when they are on this stage of sleep, we call that REM, REM, they are acting out. They are not paralyzed. They are punching, kicking, moving a lot, screaming, having vivid dreams. And because this is not a deep sleep, they wake up. Okay? That's a reason for people to wake up if you have Parkinson. Not all the patients with Parkinson will have that, but it's very common. And the treatment, you start with melatonin, that in my opinion, usually never work, at least in my clinic. There are some patients that they might find benefits from melatonin, 3 milligrams. I don't think you should go more than 5 milligrams because actually it might make vivid dreams even worse. But somehow, that I don't understand how melatonin do that, but decrease REM, REM, this stage, and technically you might get better with that. But the best treatment, And this is the only time that I use clonazepam in the setting of Parkinson's disease is when patients have severe REM sleep behavior disorder. And I'm talking about clonazepam. So a low dose of clonazepam, 0.5 milligrams. Sometimes I start half of that 1 hour before bedtime. It might help with those very bad dreams that you are acting out and wake you up. And some people actually fall from the bed having trauma. And when you're having trauma and safety is an issue, you need to use a clonazepam because melatonin I don't think will help you. You can try, but the majority of the patients end up taking clonazepam when they have severe REM sleep behavior disorder. The last reason that I'm going to talk is this happen not only in people with Parkinson, also in people without Parkinson. When you get older, your bladder doesn't work well. But in people with Parkinson, it's even worse. So the problem is that the bladder, when your bladder feel fluid, a little bit of fluid, it get activated. So this muscle of the bladder is so sensitive when you have Parkinson that a little bit of fluid wake you up and you need to go to the bathroom. So you have an urgency. So that wake you up. So first thing to do is number one, with and without Parkinson, is make sure that you decrease the amount of fluid and actually don't drink any fluid 3 hours before bedtime. Except you have to take a pill that you have to drink a little bit of water, but otherwise minimize fluid 3 hours before bedtime. And obviously, the last thing that you would do before go to bed is go to the bathroom and pee. That's the first thing. Now, if this doesn't work and it's affecting your life, your function, and your sleep, because you don't sleep well, things are not going to work well. Then you need to use medications. The problem with medication is that you have to be careful which medication. Oh, before talking about medication, there is some exercises that you can try because there are exercises that make those muscles stronger. So I want you to Google pelvic floor exercises, and try to do those exercises before trying medication. You always try to minimize medication as much as you can. Okay, medication or surgery, last option. But some patients, because it's so severe, imagine that you wake up 5 times. I have patients that are waking up 5, 6 times to go to the bathroom. Can you imagine that? So those patients, doesn't matter how much exercises do you do, you will need a medication to calm down this excessive contraction. But again, you have to be careful which medication, because there are medication that we use for the bladder that will make your memory worse. You might have delirium, especially if you have cognitive memory issues. So I'm talking about that you have to avoid medication with a strong anticholinergic effect. That's the medical term that we use. So basically, this type of medication decrease a chemical in the brain that is related with memory, right? We want this chemical in the brain to remember things. And this medication, especially when the majority of them will cross the blood-brain barrier, which is a wall that we have, a barrier that we have in the brain to protect us. So those medications cross the blood-brain barrier, and then it might make you more confused and many other side effects that you don't want to deal with that. So I'm talking about the most common prescribed medication for the bladder, and it's very cheap, is oxybutynin. If you have Parkinson, don't take that. Okay, don't take that. So I would recommend, if you really need medication for that, there are two medications that you can try. One of them is miravigrone, and you will see the medication in the screen. And the other one is Gentisa, and Gentisa is Vivegron, and you will see the name in the screen. So this is the only two medication I will recommend. if you have overactive bladder in the setting of Parkinson's disease. Now, if you have low blood pressure, mirabegron would be better because mirabegron has a side effect, increase the blood pressure. Okay, the other one, no. So that's the main difference between these two. Both of them are very expensive medication. Now, frequently, many patients they cannot afford these two medications because they are very expensive. So what do? So then you have to use one of the anticholinergic medications, but the one that doesn't cross the blood-brain barrier. And the best option that we have is trospium, trospium with T, trospium. You will see the name in the screen. So this one, in my opinion, is not too effective like the mirabegron and the vivegron, but this is what we have. That's my third option because even though that this is an anticholinergic medication, and you will have the constipation and the other side effect with that you have with the other anticholinergic medication, but because it doesn't cross the blood-brain barrier, you don't have to worry about the confusion thing. Okay? Now, remember, this problem of the bladder, when you turn 50, you will have issues with your bladder, okay? The bladder is not going to work the same way that when you were 20s or 30s, that you can drink a liter of water before bedtime and your bladder is able to tolerate that. After 50, you will wake up, okay? So the problem is with people with Parkinson is very pronounced because they have problem with the bladder. This is a very common thing. Now, let's talk about why people without Parkinson, the general population, wake up at 3 a.m., 4 a.m., or after 3 hours, 4 hours of sleep. Reason number one, and there are many reasons, but I will discuss about the most important reasons and what to do about it. Reason number one is anxiety. This is the most common cause of people with Parkinson's disease and without Parkinson's disease to wake up in the middle of the night. In other words, if you are one of those that wake up at 3 a.m., 4 a.m., 2 a.m., you need to ask yourself if whether anxiety is playing a major role or not. And these are the common symptoms to try to identify if you are one of those patients, one of those people that wake up in the middle of the night because they are anxious. So if you feel like you wake up and you have racing thoughts, which like worry about many things when you wake up at 2 a.m., you need to consider that maybe anxiety is a problem, right? Also, rumination. What is that? Rumination. Rumination means thinking and thinking about the same thing over and over, the same issue. And also, like the what if? What if? Like, for example, what if I lose my job? What if something serious is going to happen to me? What if I cannot sleep again tomorrow? So everything is a what if. So also people with severe anxiety causing this problem of insomnia. The insomnia I'm talking about is that you cannot stay asleep. You fall asleep easily, but you cannot stay asleep. And this is when you have to think about all these reasons. Okay, so other things that you have to look is physical symptoms, such as sometimes some patients in the middle of the night when they wake up, they feel sweaty, they have palpitation, and even chest tightness when severe. Some people say that, and I heard this a lot, is my body is tired, but my mind is wide alert at 3 a.m. This is a very common thing that you hear from patients. So now, This is, believe me, this is very common, very common. And I don't need any research to confirm that. I see this all the time in the clinic, in my practice. The good news that even though the anxiety disorder is the most common, the most prevalent psychiatric condition, it has one of the highest documented treatment success rates. In other words, people with this anxiety, there are many anxiety disorders, they get better. They get better. And I will actually post a video about what to do. Okay, what to do when you have a severe anxiety, because this is a very common phenomenon. And many people are suffering about anxiety and they don't want to talk about it. And actually, the best thing that you can do is to talk about it. Okay, talk about it. And but try to be positive. Why? Because this is one of the few things in medicine that you actually can get significantly better. And many people that they have anxiety, very anxiety disorder, they are very successful. Okay. And remember, anxiety is nothing bad about feeling anxious. Actually, anxiety is a good feeling, but anxiety get bad when you cross the line and it start affecting your function. But a little bit of anxiety before a race or a 5K or or 100 meters, or before a fight in the ring or the octagon, if you are a fighter, that actually help you because you will be more alert and ready. But when anxiety cross the line, that's the problem, and this is when you have to train your brain. We will have a video about talking about how you treat anxiety um, non-pharmacologically and pharmacologically. Okay. Now let's keep talking about the another reason for people without Parkinson that they wake up in the middle of the night. Reason number two is sleep apnea, especially if you are overweight. So if you if you snore a lot, if you snore very loud, and you have this apnea, like you stop breathing, like some that your partner will tell you that you basically stop breathing, and you have daytime sleepiness. If you have one of those symptoms that I just mentioned, you better get a sleep study. You better get a sleep study. Why? Because if you don't treat the sleep apnea, the chances of you having many diseases increase. Not only that you cannot sleep well, and when you don't sleep well, you will have issues with the memory, working memory, attention, concentration, your mood get affected. But not only that, your heart starts suffering the effect. Your lungs, your heart. So those patients are predisposed to have strokes. Those patients are predisposed to have heart attacks. So you better treat that. So, and the best way is to check for that. How do you check for that? Get a sleep study. Okay, talk to your doctor, and your doctor will order a sleep study, and you have and and if the sleep apnea is confirmed, you need to see a sleep medicine doctor. So there are doctors specialized on that. Okay, and the treatment is to use this machine, which is the CPAP. Beside, you have to uh, lose weight, because many of the diseases that we have, including sleep apnea, goes away when you start losing weight. It goes away. Diabetes type 2, hypertension, dyslipidemia, many of those diseases, um, it get better or disappear when you start losing weight. Okay, so that's the first thing to do. And then many patients require a CPAP or BiPAP. And some patients cannot tolerate that, and some patients require some other invasive procedures, okay, that we have available now. That is not part of the topic now. Number three. Number three is making sure that you do not have what we call in medical terms hyperthyroidism. Hyperthyroidism. So the thyroid hormone is increase. And then that will wake you up because cause you anxiety, insomnia. So make sure that if this is happening lately, like this is something new for you, you never had this problem before, make sure that your doctor check TSH, okay? That's one another reason. The other reason is if you are obese, okay, which is a very common thing, right? And especially if it's a central obesity, which means that you are obese, are in the trunk, but you have skinny legs, skinny arms, and you have high blood pressure and diabetes, and you have proximal. Many of those patients they have proximal weakness, proximal like hip muscle weakness and shoulder weakness. You have to consider what we call Cushing syndrome. Cushing syndrome is not as common like hyperthyroidism or hypothyroidism, but you see that, and it's very important that you need to identify those patients and to treat that one, because if you don't treat high levels of cortisol, right, which is a hormone that is not good when it's high at night, because then you cannot sleep. It is very important to treat that. And there is an easy screen to do, and there is a late night salivary cortisol that you can check. And if it's abnormal, you have to see a endocrinologist. Okay, endocrinologist. Now, there's other reason to wake up in the middle of the night. If you are a female and you are turning 45, 50, so you know what I'm talking about. We are talking about the perimenopause or menopause. Okay, so when you have estrogen fluctuations, you will have a sleep fragmentation. You will have night sweats and all these things that ladies suffer when they get to this age, around 50. And you might need to talk with your OBGYN doctor, because many of those patients require estrogen or some hormone replacement therapy, okay? And if you cannot, if this is severe, affecting your life, the only way to solve this problem is to use hormone replacement therapy. And if there is a contraindication for that, some people use gabapentin at night, and some people use venlafaxine, which is a serotonin norepinephrine reuptake inhibitor, that might decrease the hot flashes. But many, in order to really get better, if you are having this issue, is basically hormonal replacement therapy. And the expert on that is the OBGYN doctor, okay? Very important. Now, uh, make sure that you are not depressed. Because if you have depression, major depression, and you don't treat that, things are not going to get better. You better check and make sure that you're not depressed. Sometimes it's hard for patient to know if they are depressed or not. Every patient is different. They're not sure, but talk to your doctor. Talk to your doctor, and to find out if you are really depressed and this is and if this is affecting you, you need to get treatment. You need to get treatment, because depression get better, but you need to do something about it. And most important thing is to do exercises. So if you feel depressed, you need to find a way to do exercises. The same thing apply with anxiety, and I will talk more about that later. But in life, you have to have a purpose. If you don't have a purpose, things are not working. Things are not going to work well. So some people just buy a dog or get a dog, go to the shelter and get a dog. That might be a purpose, and you have a purpose, things move. Okay, and you will feel better because you have a purpose in life. And now to finalize, these are my general recommendation to sleep better. And this is my recommendation as a neurologist, as an internist. And also because I have a little bit of anxiety too, so I know what is anxiety. So, and that's why I am telling you that you can suffer from anxiety and you can do well in life. Okay? Now, the first thing I have to tell you is like you need to invest in a good mattress. Okay? Do not order mattress online. No, you go to the store. You go to the store and test the mattress before you buy it. Okay? But very important. If you are going to spend money in something, get a good high quality mattress. Now, make sure that the temperature in the room is correct. And I always suggest, everybody is different, but 68. I like the 68. Some people like 70. I like the 68. 68 is perfect for me. Okay, so you need to find out what is good for you. Maybe 72 is good for you, but usually people like the around 70, 70. Okay. Now, when you go to bed, everybody who is going to sleep in the room need to go to bed at the same time. If you go to bed at 9:30, like typically this is time I go to bed at 9. I'm always sleeping usually at 10 I'm sleeping. Almost always. Almost always. But my point here is that if you go to bed at 9:30 and your partner, your spouse, go to bed at 11:30, this is not gonna work because you will wake up. You will wake up. Okay? Or high probability that you are going to wake up. So everybody has to go to bed at the same time. No screen time, no playing with the cell phone or changing or playing with the remote control, that kind of stuff. You need to stop. Okay? When it's time to bed, it's time to bed. Now, if you are over 50, remember to cut down, eliminate the fluid 3 hours before bedtime. Otherwise, you will wake up to pee because the bladder is not going to work well as when you were 30s or 25. It's not the same. You are 50, 51, 52. Now your bladder doesn't work like before. It cannot tolerate the same amount of fluid. Okay? So 3 hours before bedtime, no more fluid. And before bedtime, you had to go to the bathroom. You had to pee first. Now, the room has to be dark and not without any noises, okay? This is common sense. Very important to do cardiovascular exercises. Believe me, this work, but you need to be consistent. You need to be consistent. Do something that increase your heart rate. The easy thing to do is to walk, and you can start walking 5 minutes. 5 minutes might be enough to start, and every week you increase by 5 minutes until you reach at least 40 minutes. At least 40 minutes, 45 minutes. Walking. And the speed, you start walking slow, and then progressively every week you increase the pace. Okay? I do a lot of cardio. I do a lot of cardio. So today I was running 10 miles in the morning. So that's the way that I treat myself. It's like if I don't do exercises, I don't function well. Okay, and this is what it is. Now, if you ask me about if there is any specific diet that help you to sleep, well, Mediterranean diet and the mind diet might help. Okay, Mediterranean diet. So if you ask me about which diet is associated with a better sleep, follow two type of diet: the Mediterranean diet or the mind diet. Mind diet. A mind diet is actually a combination of the Mediterranean diet with that Dutch diet. It's a Dutch diet, a diet designed to treat high blood pressure. Okay. So I prefer the mind diet, and I have a video talking about a mind diet. Now, The only thing that I don't like about the Mind diet and the Mediterranean diet is the wine. So even though that the red wine, and there is some benefits, there are some benefit definitely. I'm not saying that there is some benefit, but the benefit that you get from the red wine is related with the polyphenols, which is a very important thing that you need in order to decrease inflammation and many other benefits. But these polyphenols, you can get that from berries, especially blueberries, blackberries, and from extra virgin olive oil, nuts, without the toxic effect of alcohol. Okay? So, in my opinion, there is no benefits of drinking alcohol. And actually, alcohol affect your sleep because affect the REM. This is stage I was talking about before, the REM sleep affect that. So don't drink alcohol. That's my point. Okay. Now, if you drink coffee like me, drink coffee in the morning. Drink coffee in the morning. Don't drink coffee at noon, at 12 or 1 p.m. Why? Because you will have the effect of the caffeine. The half-life of caffeine is, I think, is 7 hours, 8 hours. And it might get a little bit, the half-life could be even longer in some patients. So my point here is in the morning, good coffee, real coffee, and that's it. Now, if you ask me about supplements for sleep maintenance, in other words, to stay asleep, there's some supplements that I can recommend. The data is very mild, very vague, but they are safe, and I use it. I'm talking about magnesium, specifically two type of magnesium. Is a glycinate, and this word I cannot pronounce that you will see in the screen. Teronate, teronate, and the dose is from 200 to 200 to 400. 200 to 400 at night, assuming that you don't have renal failure. Because you have renal failure, not a good idea to add more magnesium because magnesium is not going to get eliminated, and too much magnesium could be bad for your heart. Okay, so you have to be careful. So the other thing is that if you have anxiety, which is a very common thing in people with Parkinson and without Parkinson, I sometimes recommend what we call lavender oil capsules. Lavender oil capsules. You will see that in the screen, which might help if the problem is anxiety driven hyper arousal. So if you wake up and you feel very anxious, that might help. Melatonin, don't waste your money. Don't waste your time with melatonin with this problem, okay? It's not going to help you to keep you asleep, to stay asleep, okay? And I have a video about when to use melatonin and when not to use it, okay? And remember, melatonin, it might cause actually vivid dreams in some patients. So you don't want that, okay? So you have to be careful. Now, let's talk about this because I think this is important. If anxiety is the main problem, severe enough to affect your function, and if you are watching this video and you cannot sleep, most likely it's anxiety. Like I told you, you might need to consider medications. Okay, you might need to consider medication, real medications, not supplements. So, and then you ask me, which medication do you recommend? Which medication? And I'm going to tell you based on evidence and what I see in the clinic, what I see in my patients in terms of efficacy, what medication actually work, and what medication people are able to tolerate. Because what is the point of starting a medication if you cannot tolerate the medication because you have a very bad side effects, right? So I'm talking about the most common medication I would prescribe to somebody who is complaining, who is having anxiety disorder. disorder, because remember what I say, anxiety could be a normal phenomenon. Anxiety is good, but when it crosses the line, affecting you, affecting your function, then you call disorder. So that's a problem now. So if this is happening to you, then you need medication. And the medication I will recommend is sertraline, Zoloft sertraline. We have plenty of data about sertraline. And I will show you, because you will see online and people talking about the bad things about SSRIs and the bad thing about Zoloft and the side effect. Listen, we have plenty of data, many randomized controlled trial, double-blind, placebo, many data showing that Zoloft sertraline is better than placebo. When I say placebo, it's a sugar pill, okay? Better. I'm not saying that placebo, a sugar pill, will help too in 1/3 of the patient. Let's put it that way. But sertraline help in 2/3 of the patient. So you would be better taking sertraline if this is really affecting you. However, I have to tell you that not every patient get benefits from sertraline or any other SSRIs. There are some patients, for a reason that I don't understand, don't know, nobody knows, they don't get better. But the good thing is, in medicine, you need to try things, okay? Especially if it's affecting your function, your life, you need to try that. And I would, like I say, I will show you in the screen a bunch of study showing the benefits, and in many anxiety disorder, not just generalized anxiety disorders, there are many. And we have a lot of data in actually in panic disorder, like a panic attack, which is the worst. It's the extreme of anxiety. So people don't know what is a panic attack until you have one. Okay. So doctors can be talking and talking about panic attacks, but if you haven't have a panic attack, you don't know what you don't know what you're talking about. Okay. So it's like saying, I always say that in order to be a good coach in track and field, you need to be a runner first. In order to be a good coach in boxing, you need to be a boxer first. The same thing with anxiety and all these diseases. You need to understand how patients feel when they have a panic attack. So don't be afraid. This is my point here. Don't be afraid to take a medication for anxiety like Zoloft, okay? Now, let me tell you something else. This, like I said, this is not medication that are magic that you take it and the next day you will be fine. No, this is not this doesn't work like that. This actually modulate the way that serotonin, which is a chemical in the brain important for anxiety, that work in the limbic, in the emotional area of the brain, modulate the way that serotonin works. Okay? So it is not going to knock you out, or it is not going to give you a calm effect like benzodiazepines or alcohol that you should avoid. You should not take those medication, or you don't should not drink alcohol. But it reduce, so sertraline or Zoloft reduce hyperactivity in the fear and stress circuit over time. Okay, so require time, and in order to see some benefit, it might take weeks, at least 2, 3, even 4 weeks to get some benefits. And some people respond to low dose, some people respond to higher doses. Okay, so if you are going to start this medication, start with a low dose. I would suggest always 25 for 1 week or at least 5 days, and then increase to 50. And try to hit 100. Try to hit 100 and increase by 25 every week. Okay, but try to take 100 milligrams. And if you ask me, should I take it at night or in the morning? Take it in the morning. Take it in the morning. Number one, because certainly might have some activating properties, okay? So there are some patients that um, they prefer to take it at night. So every patient is different, but in my opinion, take it in the morning. Now, let me tell you about some side effect that you need to know, okay? About this medication certainly, and any other SSRIs. But certainly, the most common side effect that I see in the clinic is sexual dysfunction. Okay, I have to tell you that because this is very common, especially if you are close to 50. People over 50, they will have this problem, and it's less pronounced when you are on your 20s or in your 30s, but over 50 is more common. So sexual dysfunction. And when I say sexual dysfunction, I'm not talking about erection. I'm talking about delay ejaculation, delay orgasms. Okay? That's a very common thing that you see in the clinic, and people don't talk about that, but they are having this problem. Okay? So you need to know about this and don't feel bad about it because this is part of this, one of the side effects or effect, whatever you want to call it. Could be a effect, not a side effect. And sometimes it's a dose dependent side effects. Maybe what you have to do if you are taking 100, maybe decreasing to 50 might be enough. Okay. Now, another side effect that you might have with sertraline that happen in 20% of the patient is feeling sick, nauseated. Okay. Usually during the beginning, but goes away usually. But some people feel sick, and this is what it is. If you are one of those, try to take the sertraline with something in the stomach. Okay, you eat and take your sertraline. That's the two main side effects that I need to tell you. Now, another medication that I sometimes prescribe, which is very safe, in my opinion, including in people with dementia, with cognitive, with memory issues, is trazodone. Trazodone, you will see the name in the screen. So trazodone is very safe in this population that I treat, and in people over 65, it's very safe as long you keep the doses below 100. Okay, if you push too much over 100, it will cause anticholinergic effect, and you don't want to deal with that. Okay, so keep the doses in usually 25 to 50, and some patients require a little bit more, 75, but no more than 100. Okay, especially if you are over 65, because you will see the effect. Yeah. So the side effects. Now, these are the medications. These are the medications that you should avoid. Don't take these medications, especially a long term for insomnia. Okay. I'm talking about benzodiazepine like alprazolam or Xanax, Ativan, which is lorazepam, or clonidine, which is clonazepam, or temazepam. So you see all of these medication that finish with uh, um, AM, AM, they are benzodiazepine. The problem with benzodiazepines that still they have a role, especially acutely when you have a patient who just started having panic attacks and 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 they have a lot of phobias and they're very, very unstable and they need something to work quick, you know, because the function is so affected and the sertraline would take a month to do something. Yeah, those patients might require a low dose initially, but be clear with the patient that the idea of taking this medication is to taper down at some point, okay? You should not be on those medications. The problem with those medications is the cost dependence. So you will require higher doses, higher doses, higher doses. So don't go there. Try to avoid that. And the problem is you might have actually rebound insomnia, especially when you are using the short-acting medication like alprazolam. Xanax. Don't use that. The only exception I will tell you that I might use benzodiazepine, specifically clonazepam, is when you have a REM sleep behavior disorder, when you are acting out your dreams. Because remember what I told you, that melatonin, in my opinion, doesn't work. So every time that I use melatonin for patients with REM sleep behavior disorder, it's like drinking water. All the patients require, in my opinion, in my clinic, all the patients require clonazepam, but only when safety is an issue, when they are having trauma because they're falling from bed, because they're hitting the wall, because they're pushing, punching, kicking, and having trauma, then you need to use clonazepam. Okay, so that's the only time I will use clonazepam, a low dose. Other medication that you should avoid, especially a long term, and don't even try that, is what we call Z drugs, Ambien, Lunesta. So all those medications, especially if you are over 65, don't take those medications. Unless you want to have more confusion, more falls, more sleepwalking, and the next day sedation. If you want that, then take the medication. Also avoid PM, over-the-counter medication. When you go to the pharmacy, and you see, sleep aid, and you see the PM means that those medications, they have Benadryl. Okay, Benadryl. And if you take Benadryl to sleep and you are over 65, and especially you have memory issues, or you have dementia, you will have a lot of problems, okay? You will be very confused. So be careful taking PM medication, okay? If you like this video, don't forget to subscribe to my channel. See you next time.